prostate cancer is one of the most common types of cancer among American men. And we brought in an expert from Adventist Health Castle to talk about the symptoms and treatment for prostate cancer. We welcome Robin Matsukawa, MD for internal medicine at Adventist Health Castle. Thank you so much for being here. Appreciate it. Men, you're going to want to come in from the other room and listen up, because this is important. Why or what is prostate cancer? And tell me why it's an important issue for all of us men.
Well, it's an important issue because as far as men, it's the #1 non-skin cancer for men.
Okay.
As far as terms of being a killer, it is the #2 right behind lung cancer.
Wow.
And approximately 1 in 7 all men will develop cancer.
Okay.
And then also it is, they call it the cancer of the aging. So when you are older, there's greater than 70% chance of men above the age of 80 will develop it.
Wow. Okay, so what are some of the symptoms? Let's throw some symptoms out there for prostate cancer. Tell us.
So symptoms can range as simple as waking up at night to urinate.
Okay.
Also urinary hesitancy, any problems with like lower back pain, any hip pain that's just kind of nagging and doesn't go away. Also, and the most obvious is blood in the urine.
Okay. Those are all very good tips or symptoms that you need to get checked. I mean, what would you recommend? Immediately going in? Because, for instance, I have back pain. I do wake up every once in a while at night to use the restroom. Is that something that I need to worry about and go immediately to my doctor, or? Well,
luckily, as far as those symptoms, you can go into the doctor. As far as prostate cancer is not, most of them are not aggressive.
Okay.
And so that's why, as far as just being aware of those symptoms and just keeping track, you do have time.
Is there a way to prevent it?
A way to prevent it. So as far as prevention, they say the main thing is that you can't change is age.
Okay.
Family history, so if you have a father or brother with prostate cancer, you're 2 to 3 times more likely to get prostate cancer. If you have 3 or more family members, you're 10 times more at risk.
Wow.
And if you have a family member, for example, that has breast cancer also, just be aware that you are at risk, even though prostate and breast are 2 different tissues.
Somebody comes into Adventist Health Castle. How then is prostate cancer, let me ask you 2 parts to this. How is it detected, and then how do you treat it?
So as far as detection, we usually do 1 or 2 things, either the digital rectal examination.
Digital rectal examination.
Or we do a blood test, which is called the prostate-specific antigen testing.
Okay. And I know women get checked annually, I believe it is, or semi-annually for breast cancer. How often then should a man get their prostate checked?
Just as the same, which is annually.
It is annually. Okay.
That is correct.
All right. And is the test, I mean, the digital rectal exam, I mean, that might scare off a few people. Tell me a little bit about that, because that's, I mean, what does that entail? I mean, not to get too descriptive, but is that like a scope, probe?
No, it's just with the finger. No fancy equipment is required.
Okay. Well, there you have it. And you know what? It's important enough for you to have to go in and do it, because you said 70% over 80.
That is correct.
Okay.
We'll have it.
Whew. I don't know if, I mean, does this scare you at all? Because it is a little alarming, I think, and I'm hoping that it's at least alarming enough for anybody out there that symptoms, lower back pain, urinating often at night, in the middle of the night. Give me a couple.
And bleeding.
Bleeding in the urine, which is only detected by certain tests. Sometimes you don't see it, right?
At least the early stages, but once you see it, you see it. And sometimes you don't even feel any pain.
Okay.
Unfortunately. Weakness, and then bladder, again, just problems going to urinate.
Okay. All right. Those will, the symptoms and all the information that Robin just gave us will be on our website. We'll also have a link to Adventist Health Castle. And more importantly, if you're feeling any of these symptoms, any one of you out there that are viewing this right now, please just call your doctor, go get a checkup. Simple as that. Robin, I appreciate you being here. Thank you for the information.